Okay. Now the next disease is night blindness. As the name says, that night blindness is inability to see in during the night, but it is not so. It is just a misnomer that night blindness means complete blindness during the night time, but it is not so. Here what happens, the person is uh, n- has a poor vision at night. Night blindness is a type of vision impairment also called as nyctalopia. This, like you have studied about myopia, hypermetropia, so this is nyctalopia. This term you need to remember because I think it's not in your notes. So people with night blindness experience poor vision at night or in dimly lit environments where there will be poor lighting. They will not be able to see clearly, and that is why they cannot see stars in the night. They cannot see, of course stars are seen at the night only, but they cannot even see the star throughout their lifetime. Clear? Now, what is the cause? The major cause of night blindness, you have already been studying since class 9th. It is the cause of deficiency of vitamin A, as well as it's a congenital disease linked with X chromosome. So, both are the factors. Vitamin A is missing, and due to this, and plus there is a congenital disease. Congenital disease means linked with the genitals, linked with the sex chromosome, which is X linked here in this case. Okay, symptoms will be it prevents the patient from being able to see stars at night, and obstacles in a dark room. If such kind of people go into the dark room, they are not able to find out any obstacle, any chair or table which is kept in their path, and they can easily bump into that. Other symptoms may include headache, eye pain, cloudy vision, sensitivity to light, and deficiency to see for a far distance. Clear? So that is night blindness. Do not take it as a complete blindness during night time, but they have a poor vision during night. Okay? Moving forward, the next disease is color blindness. Color blindness means the patient cannot differentiate between two or three colors. Generally, red green color. They cannot differentiate between red and green color. Before I tell you much, just go through this picture. Can you read the numbers which are hidden in these circles? The first one here. What is being written here? I give you 3 seconds. Yes, this is 23. Here, can you read? 36. Here, 9. Yes. Here, 4. In this circle, 4 and 8. 48. Here, 1 and 5. Very good. That means we all are having normal eyes. We are not color blind. So, what is the cause? The cause of this disease is the mutation in the recessive gene, due to which one primary cone pigment. You remember rods and cones? The rods and cones are the cells present in the retina. Here, the recessive gene in the cone pigments of one of the retina is not synthesized, and due to this kind of abnormality arises, and this disease is of course hereditary disease. The symptoms will be, of course, you have just now gone through this. The sufferers cannot differentiate between red and green color, and sometimes the blue color also. That is why I have kept the pictures having certain blue colors also. Minor um, there is nothing called minor color blindness or major color blindness. It is of general case. That means if the person is color blind, he cannot differentiate between red, green, and sometimes blue color also. Okay, and then he will be unable to see shades or different tones of the same color. He cannot differentiate between different tones like indigo, violet, purple. All these are different tones of the same color, so he cannot differentiate between these shades also. Okay, so this is also an interesting disease. The last disease, no, one more, two diseases are left. So the next disease will be muscular dystrophy. See here, first you go through this picture. The normal biceps, see the muscles, the red color muscles here. The normal biceps, in normal biceps the muscles are so much healthy. Here what happens in the muscular dystrophy person, the The biceps are not like the normal one, they are clenched. Okay, so this happens in muscular dystrophy. The muscles of the body are not fully grown up. Why? Because here the mutation of a gene which arises due to non-synthesis of a protein. What is that protein? You need to remember. Dystrophy is the name, so the protein is dystrophin. The dystrophin protein is not synthesized, therefore calcium is not released, leading to halting of muscle contraction. So muscle contraction do not occur properly. So this is the condition. When you normally hang your hand, your muscle should be in the normal condition, but in a muscular dystrophy person, the condition of the muscles change to be this. There is abnormal muscular contraction. Symptoms will be due to inavailability of what will be the cause? Of course, cause will be I told you protein dystrophin is not being synthesized, and due to which total muscular damage can be there in the long run. Most people who have this condition are eventually needing a wheelchair for their movement, because when their body cannot contract their muscles, sorry, their muscles cannot contract or relax, ultimately they cannot move, and when they cannot move, of course they will be needing a wheelchair. There may be other symptoms which may include difficulty in breathing, because if you can correlate this muscular problem with breathing, breathing um, is being what you say is being done with the help of diaphragm, and diaphragm is muscular in nature, and other muscles which are required in the breathing, these muscles are also affected by muscular dystrophy, so they cannot contract and relax normally. So there will be a difficulty in doing these normal chores also, like breathing, swallowing something, because when you swallow, try to swallow something. When you swallow something, your neck muscles and other muscles are activated. So these patients cannot use their muscles in such a way, and then their body is very much in pain and very much abnormal. Okay, this is it.